Chapter 1, First Aid. Welcome to the lesson on first aid. In this video, we will learn about the basics of first aid, scene safety, hand washing and personal protective gear, and first aid kit. First aid refers to the emergency or immediate care you should provide when someone is injured or ill until full medical treatment is available. Now let's discuss the first aid basics. The first step is to recognize the problem and call for help. Activate EMS by calling 911. The operator will ask you a series of questions to determine the seriousness of the illness or the injury. Remain on the line until more advanced help arrives or until the operator instructs you to hang up. Emergency system dispatchers can guide you through the steps of delivering basic care, performing CPR, or using an AED until additional help arrives. Always know where the first aid kit is kept and be familiar with its contents. Know how to activate the emergency response systems and be aware of any policies within the workplace regarding medical emergencies. The best way to determine responsiveness is to shake their shoulder and shout, "Are you okay?" If the individual does not respond, then yell for help. Also, look for medical identifications such as necklaces or bracelets, which may provide clues that caused the situation. Next, assess the scene for safety. Look for potential dangers. Remove the individual from any dangers of water present, and be alert around automobile accidents. Hand washing is essential in prevention of disease and illness. Completely wash your hands and generously apply soap. Rub vigorously for at least 20 seconds, and then rinse your hands with water. Dry your hands with a towel or air dryer. If a sink is not available, then use hand sanitizer as substitution. Wash the individual's hands at the first opportunity and your own hands after each removal of gloves and/or first aid care. Personal protective gear is an important strategy to minimize the risk of blood or bodily fluid exposure. Gloves, eye protection, and a pocket mask should be utilized. Be cautious of latex allergies. When taking off the gloves, avoid touching the outer contaminated surface. Slowly pull one glove off while turning it inside out. Place the glove in the palm of the other glove hand, and then remove the second glove while turning it inside out. Now let's discuss the first aid kit. You can purchase a commercially available first aid kit or make your own. Some of the common items found in a first aid kit are bandages, gauze, antiseptic wipes and swabs, burn ointment, eye shield and eye wash, and first aid reference guide that includes local phone numbers. For a more detailed list, please refer to the manual. This concludes our lesson on first aid. Next, we will review breathing problems.